So today's topic is Thyroid 101, understanding the cause of thyroid issues. And to me, it's one of the most fun talks we do because we get a lot of people understanding their thyroid issues, and a lot of them realize, number one, they were improperly diagnosed, so they're taking this medication they do not need to take. And then number two, they realize there are a lot of natural things you can do to actually help heal your thyroid or other things that are going on. So I hope this helps understanding what's happening with your thyroid. So why is this important? Number one, cancer rates for thyroid are just through the roof. You can look at this graph here, how much they've spiked up over the past 10-15 years. Pretty crazy. Also, 27 million people in the United States have thyroid disease. It's pretty, I mean, that's almost 1 in 10 people, so it's pretty prevalent. The most prescribed drug in the United States is actually Thyroid, which is a T4 medication. Another name for it is levothyroxine, and it's a very dangerous drug. There's actually a direct link to cancer with this drug. So 20% of women who've been on Thyroid for more than 15 years end up developing breast cancer. There are other cancers that are associated with Thyroid as well as a tremendous amount of side effects. And here's the sad part. Of the 27 million people, most of these people are misdiagnosed. In this talk, we're going to go through the thyroid cycle, and you're going to see pretty easily where this can happen and why there's a lot of these misdiagnosed people who are told they have thyroid problems when they really don't at all. And just remember this, the thyroid doesn't just stop working. There's always a cause to it. So if we just say, for example, if your thyroid isn't producing enough thyroid hormone, what we want to do is just give a supplement or a medication for it, but it doesn't go deep enough. Well, why isn't the thyroid producing that much? And that's what we want to get to. So let's talk about what the thyroid is. The thyroid is what's considered an endocrine gland, which means it produces hormones that go out into your bloodstream and affect other parts of your body. And the hormones that the thyroid produces, and by the way, the thyroid, you can see it in that picture to the left, it's right over your trachea, so it's right on your throat. Okay, the hormones it produces, number one, is something called thyroxine, which we call T4. And another really important hormone is triiodothyronine, which is called T3. The thyroid produces a tremendous amount of T4 and just a little bit of T3. But what ends up happening is this. T4, which is what it looks like down here, let me draw on here for you. They call it T4 because it's got 4 iodine molecules to it, 1, 2, 3, 4. But when it's in this state, it's not active. It really has very little effect on your body. But what will happen is it'll convert, meaning you'll go through this enzyme which will knock off one of those iodine molecules, and now it becomes T3. So think about it this way. Tri means 3, iodo means iodine. So 3 iodines. And now that becomes active, and this T3 is what affects our body. So T3 mostly comes from T4. Your body makes T4, takes off an iodine, and it turns into T3, and now it's active. So what does T3 do? Think of it this way. It's kind of like a gas pedal for metabolism or energy production. What I mean by this is every cell of your body needs energy, and T3 is what allows oxygen into that reaction in order to burn up and make energy. So if we look at it this way, you have your gas pedal. If you're too low on it, it's considered hypothyroid. If you have too much gas, so if you're speeding, you have hyperthyroid. So think about it in terms of energy. Hypo means less energy. Hyper means too much energy. So let's take you through this. If you have too little T3, so you're hypothyroid, what happens to your energy level? It goes down. If you're hyperthyroid, you're making too much T3, energy level goes up. What about body temperature? Again, if you're not burning up a lot of energy, your body temperature goes down, versus it goes up. What about weight? So metabolism is your body burning off all the excess sugars and fat in your body. So if you don't do that, if you're light on that gas pedal, your weight gain will go up, versus in hyper, the opposite happens. your heart rate will go down if you're hypothyroid. Hyperthyroid will go up. And then with your mind, right? If your brain's not producing enough energy, your mind becomes depressed. If it's too much, it becomes irritable. The appearance of somebody with hypothyroid is dry, brittle skin, versus somebody with hyperthyroid. They'll get tremors. Their muscles are, you have so much energy you can't contain it, and the body will start to burn off muscle too, so you get muscle wasting. And then finally, cholesterol, which is abundant in the body. What's going to happen is hypothyroid, you're not going to burn off of this stuff, so it's going to increase, versus hyperthyroid, it's going to go down. But here's a really important point. Just because you have these symptoms, either the hypo or the hyper, does not mean you have a thyroid issue. Sometimes your body is doing this on purpose, and that's what we're going to get into. A couple other hormones associated with the thyroid. You may have heard this as well. You have something called a free T4 and a free T3. And what I mean by that is this. If you look at this picture here, this would be what we call a free T4, and this would be what we call a free T3. These are the actual, your body can't use thyroid hormones unless they are free. Most of the stuff that when you do a blood test and they just look at normal T4, T3, they're measuring this. What happens is the T4 doesn't usually just go in your blood. It needs to bind to a protein. Think of it kind of like a taxi cab that binds to the T4 so it can drive it around the blood. And then inside the cell too, you have a little taxi cab here. That would be your T3. So when you get a blood test and they're measuring T4 and T3 levels, this is what they're measuring. The problem with it is this. The T4 and the T3 aren't active until you unbind them. So you can actually get a test called your free T4 and free T3, which is a very accurate test to assess function. So when you get a blood test, your doctor should be looking at your free T4 and T3 levels. You can actually have low T3 levels here, but have totally normal free T3 levels. And what does that mean? It means you don't have a thyroid issue. It means that your body has plenty of T3 to use to drive metabolism. So, and in fact, there's studies on this. In some cases, 60 to 80% of people are told they have hypothyroid based on their T3 numbers, and when you measure their free T3 numbers, they're totally normal. So there's up to 60 to 80% of people are being diagnosed with hypothyroidism that don't have any problem at all. Another hormone is something called reverse T3, and guess what it does? It does the opposite of T3. It's actually an inactive hormone. It doesn't do anything. They call it an anti-thyroid hormone, but what it does is it competes with T3 and it binds to the cell where T3 normally does. So it just kind of blocks T3 from working. But my question is this: why would your body make a reverse T3? So why would your body make something to compete with and block your normal thyroid hormone? The answer is really simple. It's to slow down metabolism on purpose. You have to realize your body is extremely intelligent and doesn't just mess up. Okay? Give you a couple examples. If you are stressed out or you have any kind of stress, for example, your body doesn't want to just burn up all of its energy and use it. What it wants to do is store that energy and use it very efficiently in certain areas so it can either fight or run away from something, right? So if you are stressed out, your body might take T4 and instead of turning it into T3, it might make it and turn it into reverse T3 instead. So on a blood test, it looks like your T3 levels are low, when realistically, your body's doing it on purpose. Or if you don't exercise, like let's say I normally exercise and I need to burn up energy and use this energy to run my body, and then I take, let's say, a couple months off from exercising. What happens is your body doesn't want to just keep that same level of metabolism. It's going to slow up your metabolism and make this reverse T3 instead. But here's what the main point I want to take out of this. There are many things that we're calling thyroid disease, but what it really is our own innate wisdom slowing down our metabolism to deal with our sick bodies. If you are sick, if you have a disease process, if you have diabetes, your body is going to slow up the metabolism process to work on itself, as opposed to keep driving metabolism over and over. But what do we do for a solution? We measure it on a blood test, and we give you medication, and we force the body into metabolism, which makes the body more sick overall. Okay? So part of this is to realize, guys, many of us don't have a thyroid issue. Many of us are just growing sickness inside of us, and our body's just trying to slow everything down and try to deal with everything. So we need to look at that. Number two, let's look at the thyroid cycle and how these hormones work in our body. So the thyroid cycle actually starts in your brain. It starts in a really important part called your hypothalamus. And the hypothalamus is the part of the brain that's kind of aware of everything. What it's doing is it's actually measuring how much thyroid hormone is in your bloodstream. And when it gets low, your body wants to start the production of thyroid hormone. So the first thing it does is it creates this hormone called thyroid releasing hormone, or TRH. What that does is it goes down into another part of your brain called your anterior pituitary, and the anterior pituitary makes a hormone called your thyroid stimulating hormone, TSH. And it does just what the name implies, thyroid stimulating hormone. It goes to the thyroid through your bloodstream, and it tells the thyroid to make mostly T4. That T4 will then go into your bloodstream and go to different parts of your body, mostly your liver, but it'll also go in your muscles and other parts of your body, where it will convert. So your body will take that T4 and turn it into mostly T3, right over here, but it'll also make that reverse T3. And depending on the state of your body and the health of your body and the conditions, it'll drive what that T4 is converting into. Usually into T3 though. That T3 then goes to every single cell of your body and drives metabolism. Okay? Once you use up your T3 and your T3 levels drop, the brain senses it, creates thyroid releasing hormone again, and the cycle begins. Okay? This is a normal cycle, and it's really important that we understand this cycle. What I want to do though is take it apart one by one and show what happens if we're not careful or if one part of the cycle is broken. So, and by the way, I want you to see this too. The thyroid has a very small role in all of this thing. So a lot of people are diagnosed with thyroid issues. They think their thyroid is sick when it could be a problem with the liver, the muscles, the nervous system, the cells of the body. Every single part of it can cause trouble. So let's start here where this red arrow is over here and where this T4 is. Let's say for some reason my thyroid is not producing enough T4. So what's going to happen is this. Your T4 levels are going to drop. So if your T4 levels are low, you're not going to get enough. So what's going to happen to your T3 levels? They're also going to go down. So now your T3 levels are low, right? What's going to happen is your brain is going to pick up on that. Your thyroid releasing hormone is going to go up. So what's going to happen to your TSH, thyroid stimulating hormone? Your brain's saying, wow, we need to make more T4. So your thyroid stimulating hormone is going to go up. This is the classic hypothyroid patient. So a lot of doctors, and this is the danger, they don't even do a blood test looking at T3. They'll only look at, and by the way, we're talking about T3, T4. It's more accurate if we're using free T3, free T4. Don't forget that. So many doctors don't even look at this. They're only looking at TSH and T4. So if your TSH is high and your T4 is low, they give you this diagnosis of hypothyroid. And the answer for them is to chemically give you a T4 replacement, which is what Synthroid is. Okay? We want to take it one step further. Why isn't this thyroid producing T4? Couple different areas. Number one, a lack of iodine and B vitamins. So if we look, if you don't have your iodine molecules, so if you don't have iodine in your diet, you can't make T4 or T3. So there are people alone who just supplement. Now here's the thing, I live in Florida, So it's in our soil. If you eat locally grown foods, you're going to take care of this. Okay? You also need B vitamins in order to make T4 and T3. Where do B vitamins come from? They come from bacteria in your gut. So if you've taken antibiotics, it takes about 8 months to a year to get that gut flora back in order for you to absorb B vitamins in your system. So you can supplement with B vitamins. The problem is if you don't have the right bacteria in your gut, it's never going to work. So you need to have some probiotics. You need to eat a healthy diet, lots of fruits, a little bit of vegetables, and that'll take care of that. The other thing is this: chlorine, fluoride, and bromide, I'll show you on the periodic table, but they'll compete with iodine here. So if you have a lot of chlorine in your diet, fluoride, or bromide in your diet, what happens is instead of making T4, those molecules will replace where iodine is. Here's the periodic table. This is iodine right down here. Here's bromide, here's chlorine, here's fluoride. Anyone who remembers the periodic table, you'll know everything in these columns are very, very similar. So what will happen is they'll compete, and instead of making your T4, you'll make some really strange compounds that are toxic to the body. So where do we get chlorine from? Usually from our water and in our shower. Same with fluoride. They put it in our water system now, which is not good. I think many people are educated enough to know now how bad that is. But people don't realize that we get most of it by in the shower, absorbing it through the water in our shower. So you can also get filters for your shower. And then bromide is actually used in making bread today. So you got to make sure that you get fluoride-free bread in the process of this. Okay, another thing would be something we call a subluxation, which I know we've talked about in different talks. But a subluxation is really simple. It's the top bone of your neck that misaligns, puts pressure on your brainstem, and interferes with your connection from your brain to certain parts of your body. So if you have a subluxation that's affecting the nerves going to your thyroid needs nerve innervation or else it dies. So think about it this way. If we're looking here, let me erase some of this stuff here. So if you look on here, this would be your thyroid tissue right here. These nerves that transmit messages to the thyroid to keep it alive come right off the base of your brainstem. So if these bones in your neck are misaligned, they'll squeeze down on the nerves. They'll cut the connection from the brain to the thyroid, and your thyroid tissue will die over time. So if your thyroid tissue is dying, what's going to happen is it's not going to produce the amount of hormone it should. And I can't tell you how many people who've come in with thyroid issues. We just adjust them and their thyroid regulates. Then finally, a high acidic diet, high insulin diet will also cause inflammation of that thyroid tissue. So if you eat a lot of foods like meats, dairies, eggs, and then lots of grains, and especially things that are really high in complex sugars, your insulin levels go berserk. And insulin is very inflammatory to the thyroid tissue. And at first it might cause that thyroid to overproduce T4, but over time what happens is it kills off that thyroid tissue, just like a subluxation does, and that it won't produce T4. But what does the current model do for the solution? It gives you the Synthroid, which is T4, but it's a chemical that is not natural to the body, has a tremendous amount of side effects, and it causes cancer in the body. So again, to us, it makes way more sense to look at the cause as opposed to just supplementing with chemicals. Okay, let's look at the second part of the thyroid. So let's say your thyroid is producing the proper amount of T4, but instead, for some reason, you're not producing, or it's not turning into T3 properly. So what's going to happen to your T3 levels? They're going to go down. Your brain says, wow, I need more T3. So what's going to happen is your TSH, or thyroid stimulating hormone, is going to increase because the brain wants more thyroid hormone. As a result, if TSH increases, what happens to T4? It's going to increase as well. My question is this: what are you diagnosed with? Hypothyroid or hyperthyroid? Now, if your doctor isn't measuring T3 levels and only measuring TSH and T4 levels, your doctor is going to look at this and call that hyperthyroid. But if you are measuring T3 levels, what's happening? You're actually what they would call hypothyroid. And I've had people like this. I've had women literally 100 pounds overweight, which is a clinical sign of hypothyroidism with extremely low energy. But because their doctor only measured their T4 and their TSH, they were told they had hyperthyroidism, which is horrible. Or they're told they have what's called Graves' disease, which again is a wrong diagnosis. I mean, these people have low T3 levels. So it's really important to get all of your hormones measured if you're even worried about this stuff. If you just take a snapshot or just looking at TSH or T4, you can have the wrong diagnosis and be harmed tremendously. So let's ask the next question. Why would this happen? Number one is your T4, instead of it converting into T3, might be converted into reverse T3. And why would your body do that? We already talked about that. If your body is stressed, if you have disease, if you don't exercise, certain medications or chronic inflammation, what happens is your body wants to conserve its metabolism, and instead of making T3, it's going to make reverse T3. So remember, this is normal and not a disease. When you get your blood test and they tell you what normal is, ask yourself, how do they know what normal is? Where do these numbers come from? Okay? When you really understand the physiology, you can have what's called low T3 levels, and it's because your body is adapting to the situation. It's not a disease. Number two, talk about that subluxation. What if you have a subluxation now affecting the nerves going to your liver or your muscles? That liver, the muscles aren't going to know what to do, and it's not going to convert T4 into T3 properly. You could also have a fatty liver. Most people have a fatty liver today, and it's because of the high amounts of medications or because of the high amounts of complex carbohydrates, so like breads, pastas, processed sugars we get from sodas, all this stuff. When we have that much sugar coming into our system, our body has to turn it into fat inside of our liver to handle it. And then we get this fatty liver, and as a fatty liver, that means your liver can't perform all of its functions, so the T4 won't convert into T3 properly. Finally, you might not have the right nutrition. You need minerals in order to convert T4 into T3. So if you don't have a proper diet, you're not going to get certain minerals such as selenium and zinc. And again, what's the solution? Medication. Does medication solve any of those problems? Absolutely not. Finally, the third part of the cycle is, what if the brain is not sensing how much T3 is in the blood properly? So what's going to happen if your brain does not pick up on the amount of T3 in the blood? Number one, your TSH could be low or it could be high. Your T4 could be low or it could be high. Same with your T3, low or high. It all depends on what the brain is sensing. Okay? Again, you diagnosed with hypo or hyperthyroid. Depends on your doctor and how they're looking at this thing. But what would cause your brain not to sense T3 properly? Most common, or not, so I shouldn't say most common, but most dangerous would be a brain tumor, which is very rare. So most people don't have this condition. That's not the cause of it. But again, we talk about subluxation. Guys, this whole entire cycle of your thyroid is driven by your nervous system. It needs to be working at 100%. We call it the safety pin cycle, whereas your brain is up here. It's sending messages down to the body, to every single cell of your body, and the body is sending messages back up to the brain. So you get this kind of cycle and this connection from brain to body and body to brain, right? When you have a subluxation, you see this gap that's created? It means the brain might be sending the proper messages to every cell of your body, but now the cells in the bloodstream is trying to send these messages back to the brain, just like in here, these little arrows, but the brain isn't picking up on the information. We call that a subluxation. Again, that's caused when the top bone of the neck misaligns, chokes on certain nerves inside of that brainstem. So then the brain isn't understanding how much T3 is in the bloodstream, so it could create more TRH and more TSH or less depending on the person. Okay? Real quick, let's talk about autoimmune diseases. So an autoimmune disease is when the immune system attacks itself, attacks the own body. Now, my question to you is this. Do you believe that your body is that stupid that it'll attack itself? Me, personally, I don't believe that, never believed that. And there's some proof now, too. Multiple sclerosis and Crohn's disease were once thought to be autoimmune diseases, but now when they understand the disease more, they're realizing, wow, the body isn't attacking itself. So, for example, in Crohn's disease, It's an intestinal disorder where you get all these little ulcers and cuts inside the small intestine or the large intestine. And they used to believe it had to do with the body, the immune system, attacking its own tissue. But now what they're realizing is this: the immune system isn't attacking itself, it's attacking the bad bacteria in your gut. So if you take antibiotics and you eat horrible foods, you're going to grow a different kind of culture inside of your gut. And the immune system is going to attack that nasty bad bacteria, and you get this kind of war between your immune system and the gut. And then we call it an autoimmune disease when your immune system is trying to help you out. Same with multiple sclerosis. You know, it's what ends up happening is the top bone of your neck is misaligning, and I have a whole workshop on this. The spinal fluid, which is acidic in nature, can't get out of your skull, and this acid starts to eat away at your brain and break down all the tissue around your nerve system. And they used to believe it was the immune system attacking itself, attacking the brain tissue, and now they're realizing, nope, we were wrong. So when we have these autoimmune diseases associated with the thyroid, guess what? The same thing is happening. First thing is called Hashimoto's. Hashimoto's is when the thyroid is inflamed and usually underactive, and they believe it's because the immune system was attacking the thyroid. Again, your body's not stupid. Why would it attack the thyroid? How they diagnose it is they take your hormone levels. So they're looking at your TSH, your T3, and your T4 levels. And then what they're doing is they're doing an antibody test. So they'll test certain parts of your immune system to see if there's something attacking enzymes or the actual thyroid tissue itself. Okay? And then they assume that it's causing this thing called Hashimoto's, where the thyroid is inflamed. But let's talk about what's really causing Hashimoto's. Just because you have an antibody doesn't mean it's attacking the actual thyroid. Remember, they're measuring what's in the blood, not what's actually in the thyroid. So think about it this way: if I pour acid all over my thyroid tissue is going to break down and be inflamed, and that thyroid tissue is going to go break down and go into my bloodstream. And now you have bits of thyroid and thyroid enzymes that should never be in my bloodstream that are in my bloodstream. So if my body's smart, what's it going to do? It's going to create an immune response and attack that stuff that's getting in the bloodstream. So it's not a disease of the immune system. It has to do with either the acids forming around the thyroid from our high acidic diets, high insulin diets, or because you have a subluxation. If I cut the nerves going to my thyroid decays and dies, and the same thing is going to happen. So if you have a subluxation where you have a very high acidic diet, it breaks down the thyroid tissue. That thyroid tissue gets into your bloodstream, and then your immune system attacks what's in the bloodstream, not your thyroid. So Hashimoto's is really just what we talked about already. It's an inflamed, underactive thyroid because of the lifestyle we're living. Then number 2, you have Graves' disease, which is kind of the opposite. It's an inflamed, overactive thyroid. And what they believe happens, and again, no one knows for sure, what they believe happens is that the antibodies that the immune system produces mimics TSH, and it causes the thyroid to produce more and more T4. Okay? Again, how it's diagnosed, normally they just do hormone levels. Remember that example we used before, most people just look at TSH and T4, and if they see your T4 up, they'll call it Graves' disease, but most of the time it's not Graves' disease. What really causes Graves' disease in most cases, it's inflammation around the thyroid. When you have an inflamed thyroid, it'll actually cause an overproduction of T4 in the beginning. It'll cause the cells to overwork in the beginning, and then if you keep it up for a while, it'll die down, and then they call it Hashimoto's. So again, you can take lists of people who have Graves' disease, who have adapted a raw vegan diet, or who have, and I've had people in my office with Graves' disease, you get them adjusted, give them an adjustment, and their disease process goes away. Their thyroid doesn't inflame anymore, and everything calms down. So again, you look at the medical terminology of this stuff, it doesn't add up, it doesn't make sense. You put people on a healthy diet, and you get them adjusted, and life is great. So, from what we've already talked about, this is a list of things that will cause thyroid problems. Lack of iodine and B vitamins, having chlorine, fluoride, bromide in your food or in your diet, a subluxation affecting the nerves to your thyroid, a high acidic diet, high in insulin, T4 converting to reverse T3, which isn't even a disease process itself, subluxation affecting nerves to the liver, muscles, etc., fatty liver due to high amounts of medication, all this stuff, lack of minerals, brain tumor. My question is this: what does medication solve from this list? Absolutely nothing. What we want to do is reverse this stuff. Here's the beautiful thing: all of these things can be reversed, easily reversed. So let's talk about it. First thing we do is adapt an alkaline, non-acidic diet that's as local as possible. So we're getting our iodine, and that's if you live near a beach. You might need to supplement a little bit. I really don't think you need to, but some people just supplement a little bit and their thyroid problems go away. But here's what we want. We want a diet that's highest in fruits, followed by vegetables, then some seeds, then some teas. Okay? If we do that alone, look what happens to the causes of thyroid problems. Everything in red gets cleared up. So your iodine comes back, your B vitamins get healthier, chlorine, fluoride, bromide hopefully are eliminated from the diet. Your high acidic diet and high insulin diet turns. Your T4 stops converting into reverse T3 and converts mostly to T3. Over time, about 8 months to a year, your fatty liver will break down and become healthy again. And then you'll get your minerals, your selenium and your zinc, and anything else that drives the process. Number 2, get upper cervical care, which is a very specialized type of chiropractic care that we really believe less is more, and it's about putting the top bone and second bone back into place. You do that, to me it's the most trained chiropractors there are. It'll totally clear up the nervous system of any issues, and a really good upper cervical doctor is always measuring your nervous system so you can see how healthy your nervous system is. Again, what it does to the thyroid problems, it's going to help B vitamins because it's going to help improve your gut. It's going to help all the subluxation issues. It's going to help your liver work more properly so your T4 will convert to T3 better. And again, even if you do have a brain tumor or anything like that, again, with proper nutrition and a healthy nervous system, the brain tumor should break down over time. Then finally, we really believe in a fasting protocol where you take 1 day a week and 3 days every month and you start to do fasting. What fasting does is it resets your immune system, it cleans the body of any acids you have growing in there, and then finally it increases gut health and insulin sensitivity. And again, this will also backtrack from a lot of the diet stuff. Your B vitamins will be so much more sensitive because the bacteria in your gut will heal up so much. You can just read through the list. It's pretty amazing. So again, what does medication solve from this list? Nothing. What does adapting a very healthy diet do? This is the solution for thyroid problems. Okay, I mean, literally, we've helped so many people get off of their medication. And again, I'm not a medical doctor. I do not tell people to get off their medications. I tell people to become educated and look at their stuff. The last time I did this talk, I had a girl 3 years on thyroid medication. Go over her stuff, go over her blood test. She never had any hypothyroidism at all. She was told she did when she didn't. So someone like that, she can just go back to her doctor and kind of complain and get off all her stuff. And I'm sure there's many, many more people out there who've had wrong tests, not accurate tests, only measuring T3, T4, not even measuring free T3, free T4, reverse T3. All this stuff is so important to go over. Here's the cool thing: when you do this, the focus isn't on treating disease. We're not trying to treat your thyroid condition. What we're trying to do is increase the health of your body. But you can see, by doing these things and increasing health, all the conditions of your body go away. Your body was created to coincide with nature. So you live according to the laws of nature and expect health. Again, my name is Dr. Kevin Dowman, Pure Life Health Centers. I hope you found this informative. There's our number. There's our email address. We do free consultations and exams. If you have any questions, comments, concerns, please do not hesitate to call our office. Love you guys.